Nervous Women in 1901. Ladies' Home Journal informed its readers how women can keep from being nervous in 1908, and the Women's Home Companion offered help for the nervous woman in 1910. From 1907 through 1910, Reverend Samuel McComb, Associate Director of the Class for the Moral Control of Nervous Disorders, which was a series of lectures given at the Emmanuel Episcopal Church in Boston, published several articles in Harper's Bazaar and other magazines on suggestion therapy and moral re-education to remedy the malady of nervousness. The continual appearance of articles about nerves and nervousness in American monthly magazines helped to establish the notion that the challenges of modern life could cause people to feel unwell. While some sought treatment from the growing class of physicians specializing in neurology, others looked to spiritual counselors, like the Reverend McComb, or relied on themselves to deal with this modern affliction. Into the swirl of popular and medical discourse about neurasthenia, nerves, and nervousness came a new term in the 20th century, the nervous breakdown. Essentially synonymous with neurasthenia in terms of both symptoms and causes, nervous breakdowns encompassed a broad array of physical and mental woes and were attributed to the hectic pace of modern life. Businessmen were especially vulnerable to the pressures of working too hard, but housewives, children, and even the elderly were susceptible to anxieties that could lead to a breakdown. Although nervous breakdown enjoyed currency among some physicians in the 1920s, it had its real heyday in the 1930s, 40s, and 50s as a concept popular among laypeople. Some historians have described nervous breakdown as unmedical in that its sufferers tended to eschew the professional services of physicians. According to their analysis, nervous breakdown can be understood as a sort of populist notion which neither wanted nor needed legitimation from the professional medical community. By contrast, when the editors of Fortune magazine took up the subject of nervous breakdown, they looked to modern medicine for explanations and therapies. In a lengthy article published in the April 1935 issue and republished as an 85-page book 2 months later, nervous breakdown was defined as follows, quote, a state in which psychic, mental, emotional factors prevent one from carrying on the business of modern living. The term nervous breakdown has no medical standing and is a misnomer inasmuch as the nerves have practically nothing to do with the case, unquote. That said, the authors went on to declare nervous breakdown to be synonymous with serious neurosis. Although the former may have had no medical standing, the latter most certainly did. Research for the article involved consultations with, quote, a dozen or more men whose names loom largest in the fields of mental hygiene, psychiatry, and psychoanalysis, unquote. And much of the article was devoted to the work of Freud, his acolytes, and his competitors. Although neurosis was differentiated from psychosis, which often required long periods of hospitalization, it was, according to the Fortune editors, clearly a health problem to be diagnosed and treated by psychiatric specialists of the medical profession. The Fortune editors dismissed the conception that overwork brought on nervous collapse as an American legend. Quote, the psychiatrist, they proclaimed, doesn't believe in the popular idea of the high-powered executive lashing himself to such titanic efforts that he cracks under the sheer strain on his energy, unquote. The expert opinion referenced in this article was clearly at odds with contemporary medical views outside the realm of psychiatry and with conventional wisdom. Indeed, the trope of the business executive working himself to exhaustion and even further to death proved to be remarkably enduring in both popular culture and medical thought. Closely allied to the perception that businessmen were subject to undue pressures on the job was the belief that the pace of modern life could cause stress-related illnesses. The distinguished physician, William Osler, in his 1910 address to the Royal College of Physicians of London on angina pectoris, had asked, quote, has the high-pressure life of modern days made the disease more common, unquote. Readers of the New York Times in the 1920s came across several articles on the detrimental effects of modern living. An article on faith healing quoted a pastor who warned that, quote, our hurried age is multiplying nervous troubles. Experts tell us that 1/2 of all sickness is traceable to nervous disorders. Some functional disorders, like heart disease and even cancer, originate in indigestion brought on by worry and nervousness, unquote. Physician author William Sadler came to the same conclusion, quote, 250,000 persons a year die from a group of preventable conditions which I call Americanitis. The tension, the incessant drive of American life, the excited strain of the American temperament are responsible for a marked mortality increase in the decade between 40 and 50. Adaptation and natural selection have not had time to produce a race suited to the stress of a civilization which counts on the airplane and the wireless as commonplaces and intensifies its social and economic organization to keep pace with them, unquote. Heart disease in particular was linked to modern stress. According to a report on a symposium held by the Congress of American Physicians and Surgeons in Washington in 1928, quote, the stress of modern life is more of a factor in deaths from heart complaints than ever before, with a resultant economic loss to the country of $1,502 million a year from such deaths alone, not counting the cost of care, estimated at an additional $104 million, unquote. Advertisers use these dire figures to sell their goods and services. After a Metropolitan Life Insurance study reported an increase in deaths among men over 45, in which hypothesized that, quote, much of the heart disease after the age of 45 may well be the result, in some measure, of the increasing stress and strain of modern life, unquote, an ad for White Star Cruise Lines screamed, watch your husband. The copy read, quote, more than 2 million Americans suffering from heart ailments. A great life insurance company reports decided increase in deaths among men over 45 and attributes this largely to the increasing stress and strain of modern life. For overworked executives, a cruise is the ideal means of rest and relaxation, unquote. In January 1941, the Homestead Resort in Hot Springs, Virginia, advertised its spa services at off-season low rates to, quote, men at the top who know that success exacts a heavy physical toll of high tension and jangled nerves, unquote. This association between overwork and disease would grow even stronger in subsequent years among both physicians and the public, as researchers in the 1950s isolated stress as a primary cause of hypertension, and then in the 1960s identified the so-called type A personality as especially susceptible to stress-related diseases. Thus, by the time stress made its appearance in medical and popular literature in the early 1950s, as cataloged by the Reader's Guide for Periodical Literature, for the popular magazines, and by Index Medicus for medical journals, I was looking specifically for the word stress. By this time, 1950, 1951, Americans inside and outside the medical community were familiar with the conception that mental pressures could cause bodily diseases. Both physicians and non-physicians had contributed to the conversation as ideas flowed between the overlapping worlds of neurology, psychiatry, general medicine, and popular culture. Some aspects of this late 19th and early 20th century heritage can be detected in the stress concept that emerged in the second half of the 20th century, but changes in medical theories and cultural practices helped stress to develop into something quite different from its predecessors. Two streams of medical research and practice carried stress in divergent directions in the 1950s. First, stress was incorporated into the diagnosis of anxiety, for which minor tranquilizers or anxiolytics were prescribed. Second, stress was further implicated as a risk factor for chronic disease, as I just mentioned, especially hypertension and other cardiovascular conditions, as cardiologists developed the profile of the type A personality. Both of these developments received coverage in the popular press, and these parallel pathways, along with their representations and reconfigurations by journalists and popularizers, shaped the forms that stress would take in the American vernacular. So first, let's look at anxiety. In a way, anxiety picked up where neurasthenia and nervous breakdown left off, as a generalized description of and explanation for a host of mental and physical symptoms. Historian David Herzberg described it as, quote, a term to conjure with in virtually every version of post-war psychodynamic psychiatry. Identified as the chief characteristic of the neuroses in the first DSM, the Diagnostic and Statistical Manual put out by the American Psychiatric Association in 1952, anxiety was considered central to psychosomatic disorders, those physical conditions with no discernible organic causes. Like its predecessor, anxiety incorporated both external and internal dimensions. Anxious individuals suffered from the effects of outside stresses, and they displayed mental states that were especially susceptible to crisis. Until the mid-1950s, the medical options available to the anxious were limited to psychoanalysis and other forms of psychotherapy. The game changer came in 1955, when the FDA approved meprobamate, the first minor tranquilizer. Now physicians had a drug to prescribe for patients who presented with any of the constellation of symptoms that could be attributed to anxiety. Manufacturers promoted the new tranquilizer directly to doctors in advertisements in medical journals and indirectly to potential consumers in articles placed in public